Dr. Aditya, I want to ask you this. Uh, if you had to do it all over again, would you still go for becoming a doctor, or you would choose something else? You have done the three step, the 5 year of MBBS, then you got into PG, then you got into DM. Because this is a question which people would want to know. The thing that is happening is seats are increasing. Just to give you the number, India has 379 government medical colleges right now, 57,000 seats. Government has probably approved another 90 medical colleges, so another 9,000 seats are going to come in, right? So obviously the number of doctors in India are going to increase. I don't think very soon, while this number of 1 is to 834 doctors in India, including allopathy and Ayush, that takes care of the fact that the density can be very high in Delhi. It could be very poor in remote areas. So the density aspect is also there. But I want to ask you this. You have gone through the complete journey, if you will, in terms of studying. Now you're going to start practicing. Uh, is it worth the effort? When you wanted to become a doctor, was it because you had an idea that doctors earn a lot of money, or was it for something else? And now that you have gone through it, and if you could go back to class 10, going to class 11, would you
Hmm.
choose it again?
So I have two parts to this answer. Basically, there are days when I say that I would not have done it. I'm not going to deny that. There are days when I will generally say this is a absolutely worthless, useless profession. There are days like that,
Okay.
to put it bluntly. There are days when I say that nothing else would have completed me. I'm in the best place possible and I'm in the best profession possible, and nothing else absolutely will come close to what I get to do on a daily basis. To treat like let's say for example, to treat cancer or to treat a child who's suffering from cancer, and then I just recently, like yesterday only for that matter of fact, I remember the mother, the girl got diagnosed with leukemia, and she had COVID also simultaneously, and because she had COVID, she was admitted in the COVID hospital. Obviously, there was not an oncologist there, so I used to go on a daily basis in the morning and the evening to ensure that she's being taken care of. Then she got COVID free. Then she came to AIMS properly. Then we treated her. She had issues in the middle also, got infections and everything. And now finally the 2.5 year journey was culminated, and she was essentially cancer free. And the mother came just with this box of sweets because of the treatment completion. But there was this sense of gratitude that she had, obviously. And because I had been with that girl since the very beginning, like the day one of treatment, not like because as a resident, you sometimes encounter patients during their multiple stages. In the 2.5 years, possible that you maybe encounter that patient only during the 6 months to 10 months treatment period, or only towards the end half of the treatment period. So she essentially came when I started my residency, and she when I'm ending my residency, that's when she's also completing her treatment. So it's been a sort of, and I was like, there's nothing else I would do. So I will talk about two. I would say that whenever that statement came to my mind that I will never ever do this, it was never because of the problems with the field or the money, to be very honest. Money is okay. Money should never be the primary motivator. I've always said that. To a large extent, the happiness does care of the fact that even if you're not making enough money, I absolutely hate the enormous amount of workload that is there during residency, and it is not, it is inhumane, to be very honest, plain and simple. It is not, there is no question about that. I loved my MBBS. During MBBS, I was like nothing like that, and obviously I was in the best college of the country, so loved it. That portion was also there. But I feel that the residency training and the training to it never gets, you never get at a point. There are points when I feel that if people are aware of the trolley problem, the trolley problem basically is that there is a train coming, and you have 10 persons lying on that train, and then you have another, you can pull a lever, the train will go towards another side of the, it'll move, but there it is, there one person is there. So the trolley problem basically states, will you pull the lever? Because if you pull the lever, technically you are saving 10 person, but you are the person who's killing that one person, right? And if you don't do anything, those 10 persons, they were ought to be killed, they would get killed. I feel modern medicine is a trolley problem where you're pulling the lever and killing yourself to save those 10 patients or 100 patients or 1,000 patients. In the broad scheme of things, everyone will say, oh, it makes sense because only one person is getting killed and 10,000 people are getting saved. But then if you ask me personally, I wouldn't want to be killed. I'm not killing anyone. Let me be very clear. This is the modern day trolley problem is not that I'm pulling the lever and one person is getting killed. That one person who's getting killed is me. It is a resident doctor.
So you are
Okay.
saying
And
it can be sometimes very, very harsh on you in terms of the
it, it,
amount of
it
effort it
can be
requires.
absolutely overwhelming. And this is a thing which can be changed also, to be very honest. Like Dr. Mishra pointed out, there is an absolute amount of there's a difference between the culture of colleges like, let's say, MAMC or colleges like RML versus that of AIMS. AIMS comes in the better set of colleges as far as work culture is concerned, as far as hierarchy is concerned, and as far as that is concerned. But I do feel that in case of modern medicine, what has actually happened, that doctors are exploited. As resident doctors, you're exploited by your seniors. And even when you become senior, I'll be very honest, I personally feel even the corporate hospitals exploit doctors. They don't pay you as much you deserve. They get to keep most of the profits, not the doctors. Even if let's say if it not ought to be profitable, then in that case, considering the amount of efforts that we have put in, the money should be commensurate to the amount of efforts that we put in. I would join it again and again for the science part of it. Absolutely no doubt. The science of medicine, the art of medicine, the art of making a diagnosis, nothing will compare to that. And that 10th standard student took medicine and wanted to get into medicine for the science and art of medicine. But the work of medicine is horrible. It is worse than slavery. You will be able to get through the work of medicine only if the passion for the science of medicine is more than the torture of work of medicine.